Okay, let's talk about the Ezpap treatment this morning. So we have two things on this Ezpap we need to talk about. One, the manometer, and one, the flow bleed-in hose. So what we're going to do is, when the Ezpap is ordered, it's understood that you're going to try to give a pressure of 10 to 15 centimeters of water pressure without exceeding 20 during your therapy to your patient. So we're going to adjust that in two ways. One, we're going to adjust the flow that we bleed in to make that happen. And two, we're going to coach the patient so that he or she takes even flow in and even flow out, or even breaths in and out, so that the pressure doesn't spike too high or suck down too low. We want to keep a nice CPAP of 10 to 15 throughout the therapy. So how do we choose a mask or a mouthpiece, for instance? So we can do a mouthpiece if the patient is able to breathe in and out through the mouthpiece, keeping a seal, and keeping the pressure constantly hovering between 10 and 15 throughout the 10 breaths. If they can't do that, then we need to switch to a face mask so that we can help control that, and at the same time communicating and talking with the patient, trying to make that happen. What we want to do is, we want the patient to breathe in deep and out evenly. We don't want them to force the air out very quickly, thus shooting the pressure above your target range of 10 to 15. And then secondly, we're going to adjust the flow to help stabilize that CPAP during those breaths. Now, policy says that a good suggestion is 10 breaths in 3 cycles. So these are just guidelines, they're just suggestions. For most patients that'll probably work well, but ultimately what you're trying to do is to give a nice CPAP pressure in the chest as they breathe on it for a certain amount of time, and then have them cough any secretions that might have mobilized during that time. And then you want to repeat that, okay? But the most important thing is, you want to have a nice steady pressure on your manometer throughout that cycle between 10 and 15. Now, if the pressure goes too high, let's say it goes up to 25, and the next step you're going to do is communicate with the patient to calm his breaths down. Try not to breathe hard and fast, but nice and even. And if that doesn't work, you're going to lower your flow. You're going to lower your bleed-in flow. And if you get to a flow with bleed-in where it's off, and the pressures are still going above 20, then you're going to need to call a physician and find out if they're okay with those pressures being that high, and then get an order that's okay for the pressures to go that high. Because again, if it's not ordered, they're assuming that all patients' pressures are within that 10 to 15 window that we talked about earlier.